Hello everyone, my name is Quyen Su and I am a periodontist in private practice and also a clinical instructor at the University of Toronto. I began my practice in partnership with two other periodontists shortly after completing my specialty training, and implant dentistry continues to be a very large part of my practice. I still recall my very first practical application of dental implant therapy. That was during my first year of specialty training at U of T. Up to this point, I had a thorough understanding of the theoretical aspects with hours of didactic and self-directed learning, and I had plenty of hands-on experience on mannequins. I also had completed my residency at this point, was working in private practice, and was quite comfortable chairside with patients. Thus, I felt like I was well prepared to treat my very first implant case. The goal was simple. The implant itself was also relatively simple. The patient was here for an implant consultation. I would explain the benefits to him, and we would begin treatment the next appointment. What I didn't expect was being faced with a patient who had dental implant cold feet. Professionally, he was an engineer and had both the ability and strong desire to understand every aspect of his treatment beyond the typical general risks and benefits and pre- and post-surgical information. He wanted to know about the implant materials, thread sizes, differences between implant companies, and other very precise details. His anxiety carried through from the consult to the day of the surgery. His anxiety became my anxiety. I did not want to look foolish in front of my assistant, my instructor, and most of all, I wanted the patient to have a good outcome. These thoughts filled my mind as I prepared the osteotomy. They continued to play on my nerves as I was careful not to perforate the bony plate, cause paresthesia, or risk poor angulation of the implant placement. Why am I telling you all this? You're surely all quite capable of explaining these concepts and calming your patients. However, your first time or first few times may nonetheless fill you with anxiety. I'm here to tell you that I will be there to guide you through that process. The feeling of accomplishment post-surgery will be incredible. I fortunately was able to overcome my nerves. The patient reported no post-surgical pain, and later he referred his wife to me. That was my first experience with implant dentistry, and I was hooked. The majority of surgeries since that first one have been far more complicated, but I have learned what techniques to use, those to avoid, and how to overcome obstacles along the way. And I hope to share these with you. During the high-tech dental seminar course, we will teach you how to communicate with your patients about implant dentistry, even the analytical and exacting patients. We will teach you how to treatment plan for implant dentistry and prepare for your cases. We will then teach you how to safely apply that knowledge to live patients. Lastly, you will learn to restore your implants and capture your beautiful work through dental photography. The number 50 is often thrown around for implant dentistry as the number of implants one must place in order to be more comfortable. Your number may be higher, your number may be lower. I hope that you'll join me and the rest of the team on this journey of implant dentistry learning. Let's discover together the amazing therapy that implant dentistry can provide patients, which in turn will provide you with professional satisfaction. Thank you for your time, and I hope to meet you at the course.